So what is the difference between palliative care and hospice care, and not to mention comfort care? Hi, I'm Chelsea, the palliative PA, and I wanted to break this down a little bit today to try to make it a little less confusing. Hospice care is a type of palliative care. So palliative care is essentially working on symptom management and quality of life. Now, the difference is when someone goes on to hospice, hospice has very specific criteria that need to be met before someone qualifies for hospice. So typically these criteria ultimately break down to the fact that someone may have a less than 6-month prognosis to live. Palliative care, on the other hand, can be for anyone with any type of prognosis, but that has a very serious illness that could be life-threatening. So for example, we in palliative care can see cancer patients that are even going for a cure. Though we know cancer could be life-threatening, sometimes it's curable. And if it is curable, we can still help with your symptoms and your pain along the way. The other examples are things like CHF, congestive heart failure, COPD, pulmonary fibrosis, dementia, end-stage liver disease, end-stage renal disease, and lots of others. Now, I've gotten lots of questions about things like chronic autoimmune diseases and other diseases that are very serious and very difficult, but are not necessarily life-limiting. And I would say that, at least in my palliative practice, we don't typically see people with autoimmune diseases and things that are likely a very long prognosis otherwise. Now, whenever we're talking about comfort care, so palliative care and hospice care are both types of comfort care. But even under that umbrella, there's a couple different types of comfort care. I'm actually going to do a follow-up video on comfort care as an umbrella term and how I at least see this breaking down. So follow along for that one.